And of course, this is absolutely translatable to the IVF process of PGT-A.
Robert, let's talk about the IVF with own eggs. How is the process organized in Greece?
Yes, of course, this is possible also for couples which are looking for own eggs procedures. And this process is starting with digital appointment, confirming all these details about the treatment. After collecting all this data, medical data, we are preparing the correct protocol. This is also very important because now we have the patient with higher age comparing in the past, that we are preparing special protocols with mild stimulation, minimal stimulation, and of course, in case that it's important, we also inform the patients that maybe it will be necessary to visit us more than one time to collect the eggs, yes, and to have the enough eggs for treatments. Afterwards, we organize the medicines and the information about the protocols. The patient is starting all the procedures in their hometown, cooperating with British doctors, and the possibility to come to Greece only for 2-3 days for the oocyte pickup. It's very important for them, not conflicting with professional duties of the patient. After egg collection, our lab procedures last about 6 days until the blastocyst stage, and then the blastocysts are frozen. If we are looking for a better number of blastocysts, that we want to have more than 2, 3, 4 blastocysts in case that we are not going through the PGT-A process, having the opportunity to work the blastocyst formation like a biological filtering in this case. And after all this process of collecting the blastocyst, now we start to preparing the patient to the embryo transfer. Of course, this is another issue, that this process allowing us to prepare better the endometrium in case of older women also. In some cases, and obligatory after the one negative embryo transfer, we offer very sophisticated examination of uterine cavity. We use the new method, which is called HEFI, it's hysteroscopic endometrial fundus incision. And this method is well known in the past, like endometrial scratching. Now, of course, it's a new one, and after direct control from the operator, and performed based on the protocol, that it's every time the same protocol. We are cutting the endometrium until blood vessels. That's it's the same protocol. In this time, we perform also another test, the microbiome test for the endometrial bacterial flora, and also we are able to perform the endometrium, the implantation window time test. era or be ready in the same time. That having this knowledge that the negative tests and all these unsuccessful treatments are 80% from the embryos, we have about 20% for the uterus reasons. That after the unsuccessful embryo transfer, this is very important to confirm that the uterus cavity, the endometrium, is working properly.
Many of our viewers are definitely interested in PGT-A. Can you tell us a bit more? Actually, who needs PGT-A in their IVF cycle?
Yes, this is very good questions, and I answer very quickly and very simply. In my opinion, every woman performing IVF treatment may think about PGT-A. Why? Why? Because even very young women can face with abnormalities, genetic abnormalities, which are not confirmed and not diagnosed in this time. That having the opportunity to check the embryos in the blastocyst stage, I think that this is the game changer. Of course, it's not strictly a factor which is growing our pregnancy results. It's very simple, protecting the patients from abnormal transfers. The transfers with abnormal embryos, which is resulted with negative results. That this is the really normal and today very important factor in IVF treatment. That, in my opinion, every patient can think and must think about PGT-A treatments and PGT-A results in their fertility journey. The process is the lab process, that it's not involving generally the IVF protocols. It's the process which is starting on day 5 of embryonic life, that from the blastocyst we are collecting some cells from the trophoderm, and these cells are checked with NGS, next generation sequencing system, the best system nowadays we are. Then in 24 hours after this procedure, we have the results. Of course, all the point is that the nowadays equipment need 21 embryos for check. That the patient may be very happy and have the results after 25 hours, or maybe wait 2 weeks to complete the samples into the machine, into the sequencer. And this is the reason that we are waiting sometimes until 2 weeks for the results. But in general, the run on the NGS lasts 24 hours. This is the true answer. That I think that it's very, very important for all the patients, and even thinking about that the procedure, invasive procedure, that we are collecting some cells from the embryo. I think that nowadays with our embryologists who are very, very experienced in this, the possibility to damage the embryo, it's absolutely unbelievable in our time. In other way, we are working on non-invasive procedures. We are very, very close to use generally non-invasive procedures. And the example of this is the NIPT. NIPT is non-invasive prenatal test performing during pregnancy. I remember very well, 10 years ago, all the doctors was in panic. How it's possible to collect the blood from the pregnant woman and to find the child DNA, the baby DNA inside, and how precise is this technique, and is it possible to give us the results. The procedure started from about 70% of accuracy, going in 2 years to 95, 96%.
Wow, that's amazing.
Yes, that's now we are really using only the non-invasive techniques in this field. And of course, this is absolutely translatable to the IVF process of PGT-A, which is going absolutely in this way, that every year these procedures, non-invasive procedures, are going better, better and better, and now they are ready to be present in our everyday practice. I think that maybe next year we will work only with non-invasive procedures, and step by step the older one invasive procedure will be allowed to in the past of the IVF medicine.
That's it for today's interview with Dr. Najdecki. See you next time on IVF Off The Clock.